Signs of a heart attack and stroke are different in men and women. How to recognize common symptoms. Despite the fact that heart disease remains the biggest cause of mortality for both men and women in the United States, the indications and symptoms of this life-threatening condition can vary greatly by gender and are frequently more subtle in women. A study published in the journal Circulation of the American Heart Association, AHA, indicated that while both men and women are likely to have chest discomfort as a result of cardiovascular illness, women frequently experience additional symptoms, such as nausea and upper back pain. And the review's author emphasized the significance of recognizing these disparities in symptoms. Corrine Jurgens, PhD, states symptoms are of fundamental importance not only to the diagnosis of cardiovascular disease and evaluation of response to medical therapy, but also directly to patients' lives. Symptoms are the primary driver of healthcare utilization and a substantial contributor to life quality. Women tend to be diagnosed with heart disease later in life than males, according to the analysis, since they are more likely to have underlying disorders that make recognizing symptoms of the disease more challenging. Women are often older than men at the time of diagnosis. Consequently, many have a greater concomitant disease burden, Jurgens added. Age-related comorbidities include osteoarthritis, atrial fibrillation, chronic lung disease, peripheral vascular disease, and heart failure, among others. If you like this content, please like and subscribe so you don't miss out on future videos. Here is a closer look at the new review and the cardiovascular disease variations between men and women. Cardiovascular disorders and their signs. The newly released study examined the differences between male and female symptomatology related with 6 cardiovascular diseases. Heart failure. The most common sign of a heart attack in both men and women is chest pain, which might feel like squeezing, heaviness, pressure, burning, or overall discomfort. Women and men have identical chest pain during a heart attack, explained Jurgens. Smadar Court, MD, says that several of the extra characteristic symptoms, such as cold sweat and inexplicable jaw, neck, or thoracic discomfort, that males come with are not always present in women. Women have atypical symptoms, which makes it more difficult to detect them, Dr. Court explained. Some of these symptoms may be confused for muscular discomfort, rib inflammation, or respiratory conditions such as asthma. In addition, women are more prone than males to feel nausea and upper back pain, according to Jurgens. And especially younger women with heart attack symptoms are more likely to have a cluster of 3 symptoms than males. Stroke. According to the Centers for Disease Control and Prevention, CDC, a stroke occurs when something obstructs the blood circulation to a portion of the brain. This is also referred to as a brain assault. A stroke may also result from a ruptured brain blood artery. Common stroke symptoms include arm weakness, difficulty speaking, face drooping, as well as confusion or vertigo. However, women may also exhibit extra symptoms. According to the analysis, they include headaches and a more significant modification of mental state. Cardiac failure. According to the CDC, heart failure happens when the heart cannot pump enough blood and oxygen to support other organs in the body. Most frequently, heart failure will manifest as shortness of breath. This occurs when the heart fails to pump blood properly. This is also possible after a heart attack has occurred. In this situation, symptoms would include an upset stomach, appetite loss, mood changes, memory difficulties, and exhaustion. There may be even more symptoms in the case of women. Additional symptoms include perspiration, acid reflux, odd puffiness, and heart palpitations. In addition to the previously listed symptoms, women may also feel depression or anxiety, according to the analysis. Cardiovascular disease. According to the CDC, heart valve disease is a disorder in which a heart valve is damaged or diseased. There are numerous potential reasons of valve disease. Breathlessness is the most common symptom of this illness. As a result of heart valve problems, men will likely have chest pain. Women, meanwhile, may have difficulty catching their breath. Additionally, they may encounter obstacles during physical activity and exercise. Rhythm disorders. Atrial fibrillation, often known as an irregular heartbeat, occurs when the heart beats either too slowly or too rapidly. According to the CDC, it can also develop when a heart beats erratically. Symptoms of this illness can include chest fluttering in women, but men typically have no symptoms. Sometimes, other symptoms include weariness, chest pain, and vertigo. Peripheral vascular disease. According to the CDC, peripheral arterial disease in the legs or lower extremities is a significant consequence of heart disease that involves the constriction or occlusion of blood arteries that deliver blood from the heart to the legs. This disorder is typically the result of fatty plaque obstructing arteries. The most prevalent symptom of this illness is leg pain linked with activities such as walking, which improves with rest. though 4 out of 10 individuals may not experience such agony. Women may also have other illnesses with comparable symptoms, such as osteoarthritis, which can lead to peripheral artery disease going undetected. Substantiating conditions can mask symptoms. The research paper concluded that women, in particular, may have underlying illnesses and symptoms that make it more difficult to spot signals of cardiovascular disease. Some of the symptoms, such as shoulder, arm, and upper back discomfort, shortness of breath, and chest pain, may be misinterpreted for muscular pain and weakness or respiratory conditions such as asthma. And while some cardiovascular disease symptoms are frequent and well known, others can be uncommon. In addition, individuals may not associate underlying illnesses such as weariness, sleep disorders, depression, or weight increase with cardiovascular diseases. Fatigue is a typical symptom of many cardiovascular conditions, although it is often attributed to aging, increased activity, or sleep disturbances. Depression, which is frequent in cardiovascular illness, may also make symptom recognition and attribution more difficult. Differing risk factors and late-stage diagnosis. Even though women and men share several risk factors for cardiovascular disease, such as high blood pressure, smoking, and diabetes, there are also notable variances. For instance, women with premature menopause, preeclampsia, or gestational diabetes are at elevated risk. Premenopausal women have enough estrogen hormones to protect them against heart disease, but, following menopause, the risk for heart disease increases as estrogen levels decline. Estrogen can protect against heart attacks by suppressing the inflammation that contributes to plaque accumulation in the coronary arteries. As long as they are premenopausal, estrogen protects women from the effects of menopause. After menopause, women are no longer shielded and face the same dangers as men. Despite national attempts to raise awareness of the disease, a lack of information may also be a factor in why women are diagnosed later in life, according to health experts. Specifically, an special research indicated a 10-year reduction in women's understanding that heart disease is their greatest health risk. While awareness of risk factors such as diabetes, hypertension, and obesity has increased among women younger than 55, awareness of heart disease as the leading cause of death among women has decreased from 65% in 2009 to 44% in 2019, particularly among younger women aged 25 to 64, according to Jurgens. Women's cardiovascular disease is the main cause of death, despite decades of efforts by groups such as the AHA to promote awareness of this danger. Many incorrectly assume that cancer is the leading cause of mortality, Jurgens stated. Despite the fact that education and awareness initiatives have not decreased, there continues to be less knowledge of the possibility of cardiac disease, leading in delayed presentation. Dr. Court stated, "Women tend to consider others and care for others before themselves. Therefore, they will seek attention later in their presentation. In general, the medical community is less knowledgeable about cardiac disease in women, which results in a delay in making the accurate diagnosis." Jurgens stated that not all doctors felt fully qualified to assess cardiovascular disease risk in women. In light of the findings of the scientific analysis, health experts advise women and others to assess their risk of getting heart disease and become familiar with the condition's subtle signs. "It is neither too early nor too late to have that discussion if it has never occurred," said Dr. Court. "Many risk factors are changeable, and a plan should be implemented to lower these risk factors and build good habits to reduce the risk even further. Readers should learn to listen to their bodies and seek medical assistance for any new symptoms. It is preferable to be evaluated and informed there is no cardiac disease than to overlook one," Dr. Court remarked. Women should have the same compassion and care for themselves as they do for those in their immediate environment. Thanks for watching. Check out some of our other videos on today's latest health topics.